Hello and good afternoon, everyone. Welcome to our webinar. So from clicks to progress, my name is Oscar San Roman, and it is my honor to be your moderator. Today, we will have a fantastic lineup of speakers and panelists who will discuss the transforming power of digital technology to reach the SDGs, especially number 3, and guarantee healthy life and promote well-being for all in Latin America and the Caribbean, especially the youth. I would like to let you know that we will have simultaneous interpretation, English and Spanish, which you can activate by going to the bottom of your screen and clicking on the interpretation globe. Also, during the presentations, you can share questions throughout, which we will answer at the end of our session. Now, I would like to give the floor to Dr. James Fitzgerald, Director of the Health Systems and Services Department. He will be our speaker opening this session.
To all those connecting, and a real heartfelt thanks to all those who will be actively participating and speaking at today's event. It really is my pleasure to welcome you today to this webinar that commemorates International Youth Day 2024 under the theme From Clicks to Progress, Youth Digital Pathways for Sustainable Development. This day really offers us a meaningful platform to amplify, I think, the important role that young people play in digital transformation and transition. We all understand the vital role digital technology is playing in achieving our sustainable development goals that we have committed to. Digital transformation not only reshapes our societies, but it also revolutionizing the delivery of healthcare. In this regard, we at the Pan American Health Organization are completely dedicated to ensuring that young people are central to these transitions. By listening to and collaborating with our youth, we are very convinced that we can build more resilient and more responsive health systems for young people as well as for all others. The concept of the life course approach really emphasizes the need to address health needs at every different stage of life. For youth, this means integrating digital solutions that promote accessible and personalized healthcare that responds to their specific needs. Whether it's through telehealth services, mobile applications, or indeed AI-driven health solutions, we really need to move forward rapidly and harness technology, both creatively and inclusively. Today's intergenerational dialogue will explore how young people can help drive digital innovation to improve health outcomes and contribute to the achievement of our SDG 3 and other related goals. So I really want to once again welcome you all and to ask you to engage actively in this discussion today. Thank you for all being here, and I really look forward to your recommendations and how we can support each other on this journey.
Thank you very much, Dr. Fitzgerald, for your words. And now, before starting with our first speaker, I'd like to share, and I would like to learn more about our audience. We have a Mentimeter, and please take your cell phones and based on the fact that today is International Youth Day, IYD 2024, we would like to know who's here. Please answer this, and we're going to write the code here in the chat. So I don't know if I'm able to do this, but anyway, yes, we have the code, and please use the QR code here to take our poll. All right. So what's the age of our participants? Here, we have the ages of the participants who are with us today. Let's see as they answer what the results will be of our different age groups. I'm going to switch now to the next question. Now, we would like to know what country you're coming from or you're visiting us on this website. Oh, so here we have the countries appearing on the screen. All right, Argentina, Mexico, Peru, Bahamas, Guatemala, Mexico, Panama, Venezuela, Peru, Dominican Republic. 27 so far, but please, we want to hear from all of you, from all the attendees. And then finally, we have a last question to ask you. As we've repeated already, today is IYD, International Youth Day 2024. So, what is your opinion here? Are social networks destroying our youth? What do you think? Are social media destroying our youth? So, do you agree or don't agree, or you're not sure? And you can share with us in the chat why you answered what you answered. And that way we will be able to ask our panelists accordingly. Very interesting to learn about this. Some people are quite in agreement, others are in disagreement, and then there's another group who are not sure. Now that we know the age groups, the countries where you're coming from, and your opinion about whether social media are destroying our youth or not, now I would like to um, go to our first speaker. Our first speaker is Mirna Marti, who's a consultant in information systems, and she works in the PAHO's Department of Evidence and Intelligence for Health for Action in Health. She will talk about digital transitions in public health and the work PAHO is doing and its implications for the youth. Myrna, over to you. Yes, sorry, my mic was muted. So here we go. First, I am sharing my screen with you. And first of all, I'd like to thank you for this opportunity. It's very interesting for me to be able to be here and discuss today on IYD and talking before an audience of mostly young people. I personally don't think that social networks are destroying the youth. So that's my opinion. Again, I would like to um, greet you. I am here because the original speaker couldn't be here. And so I wanted to tell you what we think in PAHO regarding digital transformation. And I will give you some of my opinions about the role of youth in this transformational journey, as mentioned by Dr. Fitzgerald. All of this is related to our director's vision. Dr. Jarvis Barbosa has a vision, and the cornerstones of his vision include digital transformation to strengthen primary health care and understanding how strengthening healthcare information systems and also mainly through telehealth and telemedicine, uh, we have already seen firsthand during the pandemic, telehealth is very important to guarantee continuity of care and also guarantee access to health services. So it is very significant that uh, healthcare personnel and especially younger healthcare personnel are up on the importance of telehealth, telemedicine, so that we can have more resilient national healthcare systems that are better prepared not only for emergencies, but also for day to day issues that we see in our health systems. And to go back a little bit in time and give you some background about, or several decades ago, we started living in this information society where we started having a beginning information awareness. IT started to be used, and we started talking about using IT in our healthcare systems. And we had data information all over the place, but we were already beginning to think of how important would it be to manage the data accordingly. So then data becomes knowledge, and this leads to more digital awareness until we come to the point where we are today, where we have an interdependent digital society where nobody doubts anymore how important digital aspects are, especially in healthcare. However, there are new concepts, and of course, there's the need to have access to all this information in real time. So, all of this requires for us as a unit and as an organization, it requires transformation in public health. We need to have open public health where our guidelines are that the better the data, better the information and the intelligence we have, the smarter the response will be. So digital systems today are key, as I said before, they're key to facilitate continuity in healthcare and also having access to data and evidence. But we so but this information needs to be in the proper format, and we realize this is one of the critical issues. The format needs to be right, and it needs to be timely. Vis-a-vis certain uncertainties, we need to have predictive models, and for this we need to be able to trust the data that we have available. And we need to understand that we all today generate data. Not only healthcare staff, not only healthcare institutions and facilities, but each one of us as individuals, we all generate data, and the data are not always understood in benefit of everybody's health. Let me refer to a context where we live. And yes, today is International Youth Day. And back in the year 2000, we started with the boom, the acceleration in the use of technology. And so the young audience was born already immersed in the digital area, and they're aware of what's going on. And that's why I don't think it's any problem for them. I don't think it is damaging for them or a problem, because that's what they're used to. Yes, we are all more connected, but we need more information. And at the same time, we need to create knowledge out of that information, out of that data. And we need to think of better solutions as well. As we see, growth leads to questions, doubts, fears, and it also generates needs. The prediction, or there was a prediction at some point in time, of the amount of information that was going to be needed in terms of bytes, the information generated by the healthcare sector. And then we saw a problem, and it is that we don't have the capacity. So we generate a lot of information, but there is a situation that, yes, we are all connected. We all produce information. We all want more data, and we don't have where to keep it, how to catalog it, and how to retrieve it. And this is the situation. This is for the global context. But if we want to talk about our regional context as well, for Latin America and the Caribbean, we in PAHO ran an analysis of the maturity of healthcare information systems for the Americas. And let me mention some of the results showing the reality of our region in as regards digital transformation. We have a maturity model with 5 stages for 4 specific areas, strategic areas related to information systems, governance, IT, information exchange, and innovation. We ran an analysis throughout the region, and so we found that we are between level 1 and 2 of maturity vis-a-vis countries that have been doing this for more years. There are some countries in level 3 or another level 4. And so we saw that most of the countries in the Americas still collect data on paper. And this then means that it's not possible to optimize the amount of the data. So we don't trust the data, because the whole life cycle of data is in paper. So all the first collections and the infinite duplications of those are all in paper. And there are very few norms or standards for using data. And we recognize and acknowledge that according to the classification of WHO, the the we have 10 and 11, which are the ones used more often, but we need many more. Data quality is not really well monitored in the countries of the Americas, except for more relevant, or the most relevant data, except for cross-cutting themes. And whenever we go to any healthcare facility, there's a lack in this area regarding leadership and governance. There are no financial resources related to technologic development and innovation, and this is essential for the region. We need it. And also, there are no change management programs, and this is where the role of youth is very important. we need to have people who are champions or leaders eh, for organizational institutional change.
This is the role of youth, to support the change, because they are the ones who truly understand, and they're the ones who have this almost as part of their DNA. Now, there's limited trained human resources when it comes to the technology. And there's very little relationship with other sectors. It's not only the health sector, but other sectors involved in an exchange. Now, what does the exchange involve when it comes to management of knowledge? Now, the health sector does not communicate that much. And many of them, of course, use Facebook. And this is not always the social network that's most used, but we don't always use the data for the benefit of the sector or of the individuals. Here I will be moving along more quickly. We know that when it comes to future profession will be the analysis of large volumes of data. And in health, there are very few people who are trained in this area. And here we can see that youth is seeing this as a profession for the future, and they're aware of this when it comes to the health sector. Now, what is it that we are suggesting today? First of all, we need to make sure that there's open access to information, technology, mapping, medical records. So this is why we are advocating for a renewed and more transparent vision of public health, so that we can have support for this opening. And now we cannot work in silos, and we've referred to that over the years, but there are certain areas that have to do with cultural aspects. And here it is the young people who can support us in the process. In addition to a high level commitment to renewed public policy, updated legislation, all of these are areas in which the youth need to play a role with their more innovative vision, way of seeing things differently. And they can certainly work on a number of areas that have to do with public health. Now we have these different principles here enumerated in order to undertake a digital transformation of the sector. And what we see is very important is that it has to be inclusive. It needs to focus on the more vulnerable. And here I'll take another minute. We know today that there is access, and we believe everyone has access, but this isn't necessarily true. There are some remote areas and rural areas where there are serious problems in regard to access. Also in urban areas, the more marginalized groups do have access problems. There's more and more access, but there seems to be a limit. And there is still a digital gap. We talk about AI, and we imagine a world in the future that looks like this, but the fact of the matter is that in many countries, this is what occurs. A great deal of paper, no room to keep it, and old ways of storing and cataloging the information. And we need to understand that this requires an effort. And here it is young people who can contribute to public health. And we believe that this is a way that we will be able to close these gaps and be more inclusive and be more computer literate. And we know that data saves lives, and we know that the youth will support us in this transformation. So thank you very much. I tried to be as brief as possible, but I think I went over time. But I did want to share some of these ideas and what we're doing. Thank you very much, Mirna. Certainly, you've emphasized the opportunities that youth has to undertake the changes necessary for the future. These are young people who are now deciding about the future, and here they can see a role to play. Now, following, I would like to invite Dr. Bhupendra Shirawan. The presentation will be in English, so you can go to the proper channel. Dr. Shoran has designed a number of programs on digital health, as well as a number of campaigns for social networks to reach at-risk populations and marginalized populations. He has a long history of consulting for the WHO, UNESCO, IPPF, and PAHO. He wishes to apply new technology for digital health at a national and regional level. He will share some of his successful experiences and lessons learned in promoting health in youth. Dr. Shiroran, please.
Thank you so much, Oscar. Can you hear me? I just want to make sure I'm coming across okay. Great. Good morning, good afternoon, good evening, everyone. Like Oscar mentioned, my name is Sharan. I have been working on youth health and digital technology for almost 15 or 16 years at this stage, and I feel very honored and privileged to be given this opportunity to be here today to present to you some examples of things that have worked and some high-level patterns of what those successes have looked like. So because we only have 15 minutes, my apologies to the interpreters because I will be talking fast. If you do need me to slow down, please do whisper into my ears and I will slow down. But here we go. Just a second. There you go. So I want to begin with saying that, in our sector, we've been developing digital solutions for young people for a long, long time, like over a decade easily. And initially, we made many mistakes. We learned from those mistakes. We then built on some of those knowledge, and we have come to a place, we have a very good understanding of what are the qualities that are required for a digital solution to work, and what are some challenges that still continue to happen. So let me start by sharing with you some of the key qualities that are really central for successful youth digital initiatives around health. The first thing, and I think Mirna also alluded to this earlier on, the first thing that is really important to ensure that the digital solution you're designing, developing, and launching is co-designed with the young people you are planning to reach and serve. This ensures that your digital solution is based in the lived experiences of the young people you are designing for, so it is more likely to be successful, it is more likely to utilize. So that is very, very key. The second is the number of digital health solutions that I've seen over the past decade or more that have been created without a strategy in mind. There are a lot of such digital solutions that have come and gone. And the reason why they didn't last is because they did not have a strategy. They were working in silos. They were in a very isolated way. And without a strategy, they were not able to be successful. Millions of dollars have been spent on developing these digital interventions, and they were there for a year or 2 years, and then they went away. And there's been so much loss of money that could have been utilized much better if there was a strategy behind whatever digital health solution was being created. A key element is quality. If the digital solution you're creating is not of high quality, including the content that you put on the solution, the interaction that you put on the solution, the graphics, the visuals, the videos, whatever it is that you are using to build your digital solution, it should be of high quality, because young people are being exposed to a lot of digital content. And if your digital solution is not high quality, they won't engage with it. It won't even make it to their platform. They won't download it. They won't utilize it. The last thing I want to talk about is marketing. This is a very key element that is often not included when we are planning investment in a digital health solution. Most of the money goes into designing the digital health solution, but we know that build it and they will come is no longer relevant, because young people have so many digital solutions that they can look at. So a very key component of any plan for digital solution should include significant investment, long-term investment in marketing, because we have to compete with so many other digital things that young people are getting exposed to, and we have to break through that clutter. The only way we can break through that clutter is by investing in very targeted, focused, expansive marketing efforts. Having said that, what I want to share with you is some of the elements. Co-designing with youth. Well, what does that really mean? It is easy to say that, but it is very difficult to do, because co-designing with young people means that we have to train ourselves. We have to have the skills, the assets, and the tools to go out to engage young people in a deep and meaningful and sustained manner, and be able to bring them in a safe situation where we then co-design with them. There has to be mutual respect, there has to be transparency, there has to be honesty, and these are very key elements of co-designing with young people. We are talking about strategy. A very important and very useful, valuable document that already exists was created by the WHO in collaboration with multiple partners. It is a strategy framework for digital health solutions facing youth. I highly encourage you to access this document. If you already have a digital health solution, you can use this document to make it even better. It helps you develop the strategy. If you are in the process of thinking or envisioning a new digital solution, please refer to this document. It'll give you a very, very valuable roadmap on how to build something that is very likely to be successful as far as youth digital health programming is concerned. I talked about quality. We talked about content. The content has to be high quality. It has to be interactive. It has to be engaging. It has to be highly visual. Also, it has to be relevant to the young people we are reaching. If, for example, I am trying to talk to them about a topic that is not front of mind to them, then they will not engage with us. There are many times I've gone and I've talked about, say, using condoms or preventing teen pregnancies, but in that situation, young people were more concerned about depression and anxiety and violence. And so talking about condoms doesn't work unless we address the mental health issues. So it has to, whatever we are talking about through our solution, it has to be relevant. It has to be localized and in context. It has to be evidence-based. We have so much evidence-based frameworks, evidence-based curriculum, evidence-based approaches that we know work. So rather than just building something without taking these into account, we should actually look at ensuring that what we are creating is based in deep evidence. We have to make sure that our programs are scalable. The number of times I've seen programs that were started as small pilots, and a lot of money was invested in them, but they never went to scale because they weren't built to be scalable. And we lose so much time, we lose so much effort, we lose so much money. So we have to ensure that our programs, our digital programs, are scalable. They can reach the maximum number of people that could benefit from them. I talked about marketing. We have to market in a way that it is targeting young people and their allies and gatekeepers. We have to go where young people live, learn, work, and play. We can't be marketing here, whereas young people live here. The other thing about marketing is when we are building a digital health platform, rather than building a platform that sits in a silo here, and then we have to drive a lot of young people to come here, we should build digital health platforms that are actually integrated and inserted into platforms that they already are on. That ensures that they have easy access to it, and it becomes much more cost effective. This is a much more complex topic. Obviously, I can talk about marketing, quality, co-design with young people for hours, but because of time limitation, I will just give you a little bit of flavor of these key elements. And so let's talk about some examples of existing programs. Obviously, there are many, many programs that really work well. And what I've tried to do is identify the programs that highlight some of the qualities that I mentioned about. One of the first programs I want to talk about is Amaze. The website is amaze.org. It is a program that, I was lucky enough to participate in designing almost 8 or 9 years ago. And since then, we started with 10 videos and we launched in North America. Since then, we have expanded to almost 40 countries, actually 70 countries, 35 different languages, hundreds of videos, and millions of views. And the key things that were contributing to the success of Amaze was quality of the product. It was co-designed with young people. We conducted triads of youth groups and discovery sessions with young people, with hundreds of young people all over the world. And that drove the design of this program. A very key element, two key elements actually that have been responsible for its success is a dedicated investment. Recognizing that these things don't become successful very quickly, it is always important to have investment and funders that are going to be there for years and be able to invest and grow. The second thing was continuously learning and expanding and having the ability to be able to do that, and then investing in marketing. For the Amaze program, right in the beginning, there was a huge push to invest in marketing, to get the product, to get the videos in front of young people all over the world. Another program talking about co-designing with young people. This was done in Rwanda in collaboration with young people and local organizations. We actually spoke to almost 450 young people over a period of 6 months in the discovery process to truly understand what their needs were and what were the insights that would help us design something that would be useful for them, that would be valuable to them, and they will actually use. And that has been a key element of the success. Cyber Rwanda began as a small program in the capital, Kigali, and then it expanded to the whole country. And then we conducted a randomized control trial to demonstrate efficacy, build that evidence, and turn it into a model which has now been replicated in 3 other sub-Saharan countries. YouSpeak 360 was designed under the leadership and vision of Dr. Sonia Cafe, who's on the call today, on the webinar today. And I've been working very closely in collaboration with Dr. Oscar as well. We recognize that young people have a lot to contribute to the design of these digital solutions, but the problem was that it is very hard to reach, engage, and continuously talk to young people. It's a very costly proposition. So what YouSpeak 360 does is we've created a way to reach young people on WhatsApp and engage with them, give them information, but at the same time ask them questions continuously about what's front of mind for them, what is most priority for them, what are the health issues they're facing, what is happening in the communities. And this information, these insights, this evidence, these codes, they are actually then presented to program managers, to funders, to policymakers, so that they can design programs that are reflective of what is happening in the life of young people right now. For all of us who've been in the sector, we know that a lot of times evidence-based publications, they lag behind by 2, 3, 4, 5 years. But the speed at which digital health moves is much faster. So if you're looking at data from 5 or 6 years ago to design a digital health solution today, it's probably a very dangerous thing to do because things have probably changed significantly. We also should be looking at different new digital ways to reach young people. And this is a fantastic example of using podcasts. It was developed by UNICEF, and it is available on Spotify to engage with parents of young people as well as older youth, to talk about mental health, to connect them to services, etc. It's a fantastic example of taking a step back and saying, hey, what are the new places that young people are going to or are present at, and then using that platform to reach them and engage with them. We all know WhatsApp is very, very popular all over the world, especially in Latin America and the Caribbean. And here's an example of a fantastic organization called NIVI that is actually reaching and engaging young people on WhatsApp through journeys. They bring them on board, they identify where they are on their health journey, and then they become their companion, their partner over the journey to take them from a place of not knowing much, building their knowledge and awareness, giving them the tools, and then actually connecting them to local services and resources. And this is a great investment in ensuring that one shoe doesn't fit all, that we actually reach and engage with young people on platforms they already are at. And those engagements should ensure that we give them what they need at that particular stage where they are on their health journeys. So we've talked about all the successes, some challenges, some examples, but let me talk about some of the challenges. I alluded to this earlier on, right? so much money and investment has gone into small organizations, middle-sized organizations, large organizations, building siloed digital health interventions and investing a lot of money in them. But the same type of intervention has also been built by somebody else, also built by somebody else. And there's a lot of redundancy in the sector. It is very important for us to recognize. And before we build something, let's go out and see if somebody already has built something that we are trying to build and actually adapt and tailor it for our situation and reduce time and make it much more cost effective. Lack of long-term investment. You will see that all the examples that I gave you are examples of success. That was because they had long-term investment. Digital solutions, the number of solutions that have been around for 6 months or a year and then they go away, there are thousands of such examples. What we need for success is long-term investment, because like any other program, even digital health interventions require long-term investment to be successful. We have to learn, we have to improve, we have to scale, we have to get better, we have to build evidence. All those things take time. The other challenge is that in our sector, we continue to use technology that or be on platforms that are maybe no longer as popular with young people as they used to be. And I think it was shared earlier that a lot of times you're still on Facebook, whereas young people have moved on to Instagram. And now actually, when you're looking at Gen Z and Gen Alpha, they're actually on TikTok and other platforms, right? So instead of still continuing to do Facebook programs, we should take our content and actually make it available on the platforms. Let's use new tech. Let's use artificial intelligence. Let's use all these things that are becoming available to us rather than being stuck in technology that is becoming archaic and not that being used that widely by young people. Lack of strategy. A lot of times we have a very narrow focus and we build a mobile app for a very specific thing, but then there's no strategy. There's no overall framework that's being applied. There's no long-term thinking, and that contributes to these digital programs not being successful or not being long-lasting and not being able to achieve what they were trying to achieve. I'll leave you with artificial intelligence. It is here. We are all talking about it, but there is still a fear in the sector. There is still a feeling of risk. But I go back to what I was saying earlier, old tech. AI is new tech and not that new. It's been around actually for over a year to 2 years right now, depending on who you talk to. It has the potential to revolutionize our youth healthcare immensely. For providers, a lot of whom are on this program, for young people who are leaders in the sector, AI has the ability to significantly improve your efficiency and productivity in the work that you do, ability to reduce costs. You're able to do more things in less time and improve the quality of the digital health interventions. And so what I want to end with is showing you an example of what is possible here. Give me a second while I go back to sharing with you a different screen, which is here. All right, let me give you an example of something that we've been working on for the last several years. We are building solutions that are AI centered, but really focused on the social impact and the nonprofit sector. And I'll give you an example of how it can work. So let's take PAHO, for example. All of us are familiar with PAHO. We have the ability now with AI to actually say, all right, I want to create an AI solution that is specific for PAHO. So all you have to do through this platform is upload the, this is actually not correct. Give me a second. Where did you go? We can go here. We can create web pages. We can create a sitemap, and you can train it on PAHO, and it actually scrapes all the PAHO web assets, and then it becomes trained on just PAHO. So a lot of the time, the fear is that, oh my God, are we able to actually do these things in privacy and safety? What if it goes rogue and gives you stuff that you don't want? Well, actually, with AI, we can really target and narrow our focus, so it's only getting trained on the things we tell it to train on. So here, we have trained it on PAHO, and now here you go. It is generated. We already have an AI solution for PAHO. You can have it in multiple languages. So you have English, French, and there are many other languages that are available. It took us 10 minutes to build a chatbot for PAHO. For example, now if we were to put this chatbot on the PAHO website and we were to go there, it can answer us all the questions about PAHO, such as what is PAHO? I'll give you a very simple example. There you go. It's right there. It's already been developed. It's created, right? And we can do this exact same thing in Spanish as well, right? So we can create a chatbot, but that's not enough, right? What we want to do now is say, hey, I want to do more things with my AI. So we've now trained this AI on PAHO, and so suppose PAHO wants to put out a grant for $30,000 to do youth digital health innovation. So let's use this as a way to generate an RFP. So I'm asking it, hey, I want to invest it. Oh, it's telling me that this is a fantastic example. It's telling me that, oh, you have actually not given me enough information to be able to generate an RFP. So let's try again and let's see what it says. There you go. So it's actually creating the whole RFP. In the older times, I would have spent days creating an RFP to be put out, to be generated. And here it is. It's looking at the PAHO website and it's actually creating the whole RFP right now. What this does is two things. One is it gives you something to start off with, right? And with every time you use it, it becomes even better and better. The second thing it does is for leaders such as yourself, it takes it gives you the opportunity to get your time back, to do higher level thinking, to do relationships, things that technology finds very hard to do or AI finds very hard to do. So now you have done this RFP, say in 5 minutes, and it would have taken you 2 days to do it. Now you actually have what, like 16 hours to you to actually do higher level work, do strategy, do engagements, do relationships, do all these things that technology doesn't do, but we are very central. Most of us don't have enough time to be able to do all these things that are required. So with that, I just want to give you an example of how these things can work. I want to show you another place. SELFC is a youth-facing mental health, sexual and reproductive health program that also uses this program. So here we are, and it's a chatbot. As opposed to expecting young people to go to a website and they find things themselves, you open the bot and you ask them that, hey, I want to know about SELFC. What is your program? Give me a second. I'm sorry, my internet's a little bit weird today. Let me restart this. So I want to learn more about mental health in youth. So instead of trying to find it all over the website, I actually ask the question and actually gives me all the answers right there. So it's saving time. It is giving me very direct information. It is giving me what I need, what I'm looking for immediately. So it's a great example of how we can actually utilize new tech to really reach young people and engage with them. And I am going to end now with one final slide. I know it's very easy to share all these things and then go away, but what I want to do is give you an offer today. You have my email address here. If you are interested in any of these programs, if you're interested in asking more questions about how to improve the quality or make your youth-facing digital health programs much more successful, please email me at any of these email addresses. Also, if you are interested in exploring AI solutions for your organizations and for your programs, please shoot me an email, put PAHO in the subject line of that email. And what I'm going to offer you today is I am committed to giving you 1 month free access to high quality AI platform that you can then play with and see if it will work for you. So this is a great opportunity. You will get 1 month free. email me at any of these email addresses, put PAHO in the subject text line, and then talk to me, and we will be there to support you and educate you, upskill you on how to use platform, because that is new tech. It is here to stay. And the earlier we utilize it to become better at our job, to reach young people with high quality content in a more cost effective manner, the better it's going to be for us, the better it's going to be for the communities of young people that we serve. So thank you so much. I'm sorry I took a few extra minutes. Oscar, back to you.
Thanks a lot, Sharon. Muchas gracias.
All right, so now you have seen a few examples of technologies and the use of AI. And not only is this for young people, but those of us with young hearts, those who are celebrating International Youth Day today, this matters for us. Now, let's go to our first interactive panel. The title is How to Navigate Digital Platforms and Healthcare. For this first panel, we are inviting Mina Marti again and Alejandra Navarrete from the PAHO group, Youth for Health, as well as Mercedes Garcia and Siana Luna. We have a few questions here for you, and I will begin with Mirna, because you answered the first question during your presentation, but I'd like to ask you and see if you can tell us again how young people maximize the potential of digital transitions for health and development. Thank you. Thank you very much. I enjoyed the prior presentation, as I already said. And I think that regarding supporting change management, a basic role for youth is to be champions, to be facilitators, to facilitators of these changes in both public and private institutions. Young people are those who can naturally use technology. They are so familiar with it. It's second nature to them. They know how to use it. So this is one of the places where this can happen. But also there is another space where young people can have a voice, where they can share and promote digital transformation. If we continue to create, as the colleague who spoke before me, if we continue to create spaces using apps that are no longer used by the youth, then we are not listening to them. We are not paying attention to them. So we need to be able to understand the youth and where they are, what they're using, and we need to train ourselves to learn how to interact with the youth. We need to continue to do things digitally for older people like me or even older, but we cannot continue to use the same platforms such as Facebook and pretend that it's okay for the youth, because they're not going to Facebook anymore. So we need to go wherever the youth is located. Alejandra, what do you think about this first question? And would you like to refer to some of the things that Myrna was talking about? Yes, thank you very much. And good morning, everyone, or good afternoon. I would like to mention that we have good reach in social media, and we have the ability to use social media. And in this way, we can amplify the digital revolution. We need to improve education in healthcare. And we have a unique perspective to obtain the maximum benefit from healthcare services, having the access and the ability to use the technology can allow us to help communities, like during the pandemic, learning to use technology in a more effective way. We can help families make better decisions, and we as younger people can help more vulnerable people and older people to learn how to use these technologies. So I think it is important to um, learn how to use these new platforms. There are some people who don't even know that these platforms exist. As Dr. Shoran said, we need to identify medical health related needs, and we need to be able to find solutions for them. And we need to approach these needs and be aware of the barriers and be able to improve the situation and create new digital solutions with innovation. So our potential is great to transform digital healthcare and support knowledge. We hope that our solutions will provide new approaches and that we will be able to equip the youth with the necessary resources to orient them, to show them platforms so that they can implement the solutions. I think the younger generations can be the promoters of change, and we need to use the potential. We want to be involved to apply and to help develop solutions to guarantee that no one is left behind. Thank you, Ale. Now, Faye, same question.
Of information to grab from Mirna, from Ale. What do you think? How can young people support this digital transformation in health? I know from your area of work and what do you think?
Yes, no, I totally definitely agree with what Dr. Mirna and Alejandra highlighted, is that we need that intergenerational partnership and dialogue when it comes to transformation and digital transformation. Young people move fast. This digital transformation is moving faster than us. So we're even trying to keep up. So we know that with the generations older than us, it's even more difficult to keep up and more difficult to be involved. So it's like Ale was saying, we need to be that gateway, that discussion, that point, that access point to new platforms, to new technologies. I know within my own country, there's a lot changing digitally. It's very slow. The Caribbean is very slow when it comes to digital progress. But even in that slow progress, the people just can't adapt and adjust. And the communication, the marketing, as Dr. Shodan mentioned, isn't there. It just isn't brought over, and young people can lead that and lead that discussion. So we need to be involved in the process. We need to have a better role. It's not just dialogue. I know in previous discussions we've always had, we need intergenerational dialogue. It moves beyond that. It moves to intergenerational partnership and work. We need to be working together. We're not just having a supportive role. We need to be a partner in this process, a partner in this change, especially when it comes to digital healthcare, because it impacts our lives and the lives of our parents and our grandparents. So we need to be involved with the changes that we're seeing, with new process that we're seeing within our healthcare systems that we in our region are just not used to. So it definitely needs our involvement. So that's kind of the steps and role that we need to take. And yes, young people are on different platforms. They're not on Facebook anymore. They're not even on TikTok. It's moving so quickly. Me and Ale can't even keep up as the social media team, but it's where we are. It's where we're moving to. We're moving as fast as this process is moving. So that's where this needs to lead to. So that's where we need to go to as well as we're heading in this change. And like Dr. Shodan was mentioning, marketing, going where we're at, giving us a more important role is important. Yeah, thank you. Yeah. Yeah, so we understand our communities the best. Like I was giving some examples of my own country, where just like Latin America, we have a large indigenous community. There's not even healthcare services within these indigenous and tribal communities. So to speak about digital healthcare service, that's even further along the line. So when it comes to having young persons involved, that's where we can have a more impactful role. When it comes to remote sessions with doctors, when it comes to digital healthcare services that are being offered in different countries, we don't have those opportunities here. So that's where PAHO and young people can work together. Like we understand the languages, we understand what young people need within our country, and how we can bring those people in that conversation and guide them and get that level of respect. Because it's also a thing of our region, getting that respect as a young person can be quite difficult. So what we need to do is show that we have a strong partner as PAHO supporting us and supporting our messages. So that's where we need to lead the discussion too. Like, hey, we're not just talking about this digital healthcare transformation. We got the big support system behind us and guiding us to bring this information to you and to bring these tools and resources to you, because it just goes as simple as self-care, healthcare, insurance cards being digitalized and things like that. Even that is just a process starting in our region. So for us, it takes a lot. It's gonna take much for us to make that change and to be able to implement that. But if we have that level of support from PAHO, we can surely move the needle. We also need to understand what digital healthcare systems we need and where we're at, because I feel like everything is moving so quickly. We're already at AI. Within my country, we still need to digitalize these big reports and things like that. We don't have good data settings and data networks. We don't have good servers and things like that. So where are we at within the region? Where can we go to, and how do we get to that point where we're able to implement AI and implement these tools and resources where the rest of the world is already at? So it's really taking into that consideration. Yes, the world is moving quickly, but just give us the time to and guide us on how we can join that movement and join that race, to be able to offer these services and to be able to leave no one behind, because these are various resources that a lot of people in our region don't have access to. Yes.
Espanol. Mirna, I would like to have you comment on what Faye said about the indigenous communities and what PAHO can do in providing support and this initiative of not leaving anyone behind. We need to see what the youth needs to do to navigate with these transitions. Well, I believe that what Faye has mentioned is something that I also indicated. We must make sure that we don't widen the gap. When we're talking about digital transformation, especially in a region such as ours that is so disparate, and we have enormous countries such as Brazil, and then we have very small countries such as the smaller islands of the Caribbean. So we need to be very careful when we talk about strategies, when we speak of models. We need to make sure that we do not widen the gap. We need to make sure that we don't exclude other very important needs. We need to make sure we consider the indigenous communities, and there's youth in the indigenous communities. And as I said, we need to pay attention, but we need to make sure that what we have is an inclusive digital health. It's very different when we're looking at an urban area, or if we're looking at a rural area, or if we're looking at an area with an indigenous population. So we often don't consider cultural beliefs, needs, and existing skills that exist because there is no access to internet. I'm not talking of enormous distances. I'm even talking about populations close to urban areas. We need to make sure that the policies and recommendations and guidelines don't widen the gap, an existing gap. And sometimes we only talk about telehealth. And this is all well and good for urban areas. Then we're talking about the same thing. Those who are close to the service have access because they have internet access. And then we're leaving out all of those who, because of distance or cultural reasons or lacking the connectivity that's needed, will be left out. So then, once again, we are leaving behind those we do not wish to leave behind. So this involves thinking about the 8 principles necessary for digital transformation in health. Thank you very much, Mirna. Ale, to close the panel with you. Now, you've worked in the rural areas of Mexico. Now, how would you bring in the rural area? And how can you connect this to the youth involved in the transformation? What can you tell us? Well, to add to what was said, I think it's very important to, first of all, understand and study and see what youth already knows about AI. Now, for instance, we all know how to use a cell phone, but I was a rural doctor for 1 year, and what was very impressive was how we can see enormous inequalities, not only in health, but in technology. Whereas we go into urban areas and it looks like all of the children already have cell phones, they know how to use a computer. But we need to think about these other communities that don't even have internet access. They've never used a computer. So it's very important to, first of all, see what the main needs are. And we know that many people don't have access to the internet. And certainly PAHO and many world leaders can help us to focus on gaining this access to these technologies. But to better understand what's behind all of this. Now, if I want to provide a good health system, how can I do that when there are no computers? This is important. It's also important to empower those who do have access. We need to see how in an indigenous community, maybe somebody does have cell phone access to the internet, but we can explain how it can all be used. We can help in empowering people, and we can see how this can all be used more effectively. So I think that's what we need to focus on. We also need to focus on a transition in which we leave no one behind. We must work together. with young leaders, with doctors, with those who focus on the field and be disciplined and have it be multidisciplinary work. We need empowerment, and we need to make sure that we understand the gap, especially among decision makers. So I would like to congratulate everyone today for joining us. But I see that there are many participants from Mexico, many young people. Well, those of you who are in Mexico, please research the system and as future professionals, as future leaders in health, become involved because it's important for us to begin our work at home. We need to begin at home, and here we can contribute to our communities, and we need to be participants in the transformation. Thank you very much, Ale. Thank you, Mirna. Thank you, Faye. We're going to move on to our second panel. And thank you very much for your participation. With this second panel, I will ask my co-panelists to turn on their videos. Now, this second panel will be mostly in English.
Have Dr. Sonja Cafe, who's the regional advisor on adolescent health and the mastermind behind this webinar and the great work that PAHO does with young people. And we also have two other young persons from the PAHO Youth for Health group, Siana Luna from Jamaica, and we also have Mercedes Garcia from Mexico. So for this second panel, we have two questions also. And now I'd like to start first with you, Sonja. Based on what we heard and your work, do you think that our young people are really maximizing the potential of digital transition for health and development?
Thank you so much, Oscar. Thank you for the question. I've been listening and it's been very interesting, the past panel. And this question is, you could look at it, at least from my perspective, I see two sides. If we begin to package this resource as a real resource for health, for development, for young people, and not just a source for entertainment and for mischief, because sometimes there's mischief also, then young people will begin to perhaps use digital technology in a different way, because I'm sure many young people use it in a very constructive way, to do their homework, to research things, to get information. But then there are others who might think that it's just to network and have fun and send memes, etc. And I think if we keep it on that level, even though there's nothing wrong with having fun, but if we keep it on that level, then they would probably not see the abilities, not the capabilities of digital technology as a resource for development.
Thank you, Sonja. Siana, do you have, what do you think about what Dr. Sonja just mentioned? And if we are really, well, I mean, I always say we, but I'm not as young as I might look. But yeah, young people really maximizing the potential of digital transitions for health and development.
Okay, so I also have two sides that I would like to share as well. On one hand, I think there are young people who are using what's available to them the best that they can. For instance, in terms of finding information for instance, everybody, as soon as you get some weird symptoms, you see everybody Googles everything nowadays, right? We're all our own doctors at this point. We also going on YouTube to find videos, workout videos, support groups on social media, XYZ. So I do think young people are, to some extent, maximizing only it is what is available to them. And on the other hand, the question is, are they being given the opportunity to maximize the potential of digital transitions? So I think a big part of it is empowerment. I heard Ali mention it earlier. Are young people being empowered to maximize this potential? Right. So that's where I stand in terms of the question.
Thank you, Sienna. And I'll take it back to Dr. Sharon and specifically now that we discuss the AI and stuff, I remember that all the time when you Google some symptoms, you always end up having cancer or going to die soon. So
Yes.
now that you're giving us this great tool, and like Sienna mentioned, the opportunity of accessing some this AI, and there's a whole other examples, do you think that young people indeed are maximizing the potential of digital transitions?
Thank you, Oscar. That's a really good question, and I totally agree with Sienna and Dr. Cafe on everything they said. And this is not new for us, right? We know that for decades, the health-seeking behavior of adolescents, youth, young adults has been that we only seek information when we actually have a symptom. I have a pimple on my face, then I will Google pimple. And there's an opportunity for us to actually extend and expand that so that the health-seeking behavior changes a little bit with the help of technology. And I think that's where a very crucial aspect of preventative health or public health that PAHO is very centrally focused on and strategizing on comes into play. Because at this moment, digital platforms, social media, Google's websites, apps of the world are predominantly being used for education and entertainment. We all know about entertainment, right? Jokes, memes, etc., etc. Education, yes, young people are actually using them in urban and peri-urban areas to do their schoolwork. They have questions about school, they have questions about a certain topic, they are learning new skills, they're doing personal development. They are also doing formal education in the field of public health, such as like that. But where we are still struggling with is health-seeking behavior, health patterns. That is the biggest challenge, right? So how do we actually use technology to change those health-seeking behaviors so that there is a focus on preventative health, on health literacy, which we have always struggled with. And now we have an opportunity to use tech to address that in some ways. The COVID pandemic obviously was a horrible situation. The morbidity, the mortality, the number of loved ones that died, obviously we can't deny that. It was crazy. But what it did was highlighted the word public health in our discourse. Previously, folks would not talk about health or public health, but now when you go and talk to young people, they all are aware of, hey, viruses, COVID, vaccines, things that were not that spoken about. And there is a unique opportunity here, which is very time limited. There's a window of time where there's already interest generated amongst young people about their own health, about how to prevent it, that we want to use technology to reach and make health literacy a central aspect of their curriculum, of their education, of their awareness and skills using digital technology. So it can be done in a cost-effective manner, it can be done at scale, and it can be done quickly. So I think there's an opportunity there, Oscar, that I would like to build on what Dr. Cafe and Sienna said.
Yeah, and this connects perfectly because now I'd like to pass with Mercedes, who's actually student, a medical student. So Mercedes, now that to what Dr. Sharon just mentioned, and how can you highlight this part of the health-seeking behaviors and the potential of digital transitions, and if young people are really maximizing it or not?
Well, first of all, I do have to agree. Although we were born, or we are considered to have been born with technology and digital natives and all this that's said about us young people, where just because we were born with it, people believe we know how to use this. I honestly think we don't. And I think this perfectly matches what is currently going on in health specifically. Sienna gave a great example on how everyone is their own doctor today. I think we need to learn how to make this decision where we know if a source is reliable or not. And we can't do this on our own. We do need experts and adults to do this. But I also think there's a crucial role in young people when we talk about just teaching each other and understanding how it is that we can use technology and digital sources smartly. We've talked about it, or I mean, I haven't, but throughout the panel, it has been discussed, obviously. The limited access to technology in certain regions, we talked about the Caribbean before. I do think we have to work on that first in order to then teach people how to use this in a better way. I do think we have a lot of potential as young people, but we also need the generations that are before us to truly believe this and not just make this recommendation from a great stakeholder, like, for example, PAHO is, or other huge stakeholders who are giving constant recommendations, but that are not truly applied to what our current needs require.
Yeah, indeed.
Oscar, can I just add to what Mercedes, sorry, good. Because I think she raised okay, thank you. I think what Mercedes is raising is a very critical point. So Mercedes, if I may just paraphrase and extrapolate on what you just shared, the needs of different countries, different regions are different. We are on the similar journey around digital equity and digital access, but all of us are at a different phase of that journey. So having something, one shoe is not going to fit all, right? So I go back to the earlier part, which is around digital interventions that are more likely to be successful around health. It is around strategy. Having a national or a regional strategy for digital health interventions is really quite crucial, which will allow a very targeted and focused effort and investment from organizations such as WHO and PAHO, the ministries of health, local nonprofits, local youth-facing groups. And if there can be a national strategy or a regional strategy, then these things can actually work. Otherwise, we will keep doing things in silo, and 5 years later, we'll be having a similar meeting and similar conversations. There will be some improvements, but they won't be the kind of improvements that are really critical and necessary, because every month, every year that we don't reach, engage, and serve young people means that those young people are not getting access. They are facing health situations, they are facing morbidities, they are facing mortalities, they're facing mental health situations. And that is an irresponsible act and something that we should address. I do want to also share that it's easier said than done. And Sonia and Oscar and I, we know that we've done country level strategies, and these are very hard things first to do and also very, very hard to implement. But that doesn't mean we shouldn't do them. They are hard, but they are the right things to do. Thank you.
Thank you, Sharon. And actually, I want to keep in that line of country level strategy. Sometimes, and I'm sure here, our audience, some of them are just are not working in a country level, are young people who want to shape this digital trend and innovation. And what do you think, Sharon, and how can you give an advice to young people and to leaders that are listening and to the wide audience that is here? How can we young people shape this digital trend and innovation to help accelerate the achievement, specifically of the SDG 3 and the targets of SDG 3?
Absolutely. I think I go back to the Spider-Man movies. I'm going to pull a quote from there, which is very applicable to digital interventions, which is, with great power comes great responsibility. So young people have access to information in a way that they have never had before, and that is a superpower. But it comes with responsibility, which means that in addition to utilizing that information well for myself, how can I actually also mobilize a local or a citywide or a statewide or a province-wide movement amongst young people to ensure that there's equity, right? Because some of us have more access than other people. So where does equity come into play? How do people who have more access open the doors for people who have less access? And what all of this means is, in some countries, we've seen this work out, which is youth movements that are very ground level generated, and they move up and they influence policy advocacy, because eventually there are three things that will lead to the success of digital and interventions for young people that young people have to influence and lead. The first one is at the individual level. So we educate ourselves, we get access, we make our health better. The second thing is at the social level. How do we talk to other people in our communities, both our parents, older adults, older allies, as well as our peers, around what we've learned, what we have discovered, and how we can share that information. The third part is around policy advocacy. How can we then generate that evidence and do an upward movements to influence our governments through voting and through public discourse, to design and implement policies that ensure digital equity, digital health equity? Individual level works faster, social level takes longer, policy advocacy takes even longer. So how can we find allies that will support us in this journey from individual to social to policy advocacy? If we do these three things, then we are more likely to really garner the power of youth movements and youth creativity and wisdom to influence at the national level, at the provincial level, at the city level, policy advocacy, because eventually we need to institutionalize these for these to be implemented and be long-term. Otherwise, it will continue to be delivered by small nonprofits working in cost-restrained conditions in smaller areas.
Yeah, thank you, Sharon. Now I'll open the question. Sorry, for I don't know if Diana, do you want to give like a final message here, very short, about specifically this transition and the SDG 3 targets?
Yes, so everything that Dr. Sharon shared were things that I had in mind as well. I think a big part of it for young people to be true voices is to ensure that you educate yourself as well, and to prepare yourself as much as possible to be in a position where you come from a place where your solutions are effective, efficient, and can help everyone that it's targeting, right? And then as well as advocacy. I want to encourage all of us to not wait on an opportunity to get in there and to help find solutions and innovations in terms of digital technology transformations. But I think, as Dr. Sharon said, at even just the personal level, what can you do to help, right? I mean, a lot of us in our own communities, we can help with the divide, the intergenerational divide. We can help our older generation, our grandmas or grandpas, teaching them how to navigate certain things, digital platforms, etc. So the bottom line is, don't wait. Don't wait for an opportunity. Sometimes the opportunity, as we said, digital age is going really fast. It's flying by us, right? And sometimes change takes a long time in the grand scheme of things. So let's try and focus on what we can do now to push us as far along as possible.
Thank you. Thank you, Sienna. I want to invite Raymond here for if you can give us some closing remarks. I think we are like under some time pressure here. I don't know if we have time. Brenda, I'm not sure if the webinar will be closing in 1 minute or not.
No, it will keep on going. We have time.
Okay, perfect. Thank you then. Okay, thanks a lot. So I'll thank you, Reman, now that you're here, but I will leave Dr. Sonia to answer this last question, and then I'll go with Mercedes and closing with Reman. Dr. Sonia, thank you. What do you think about and link with what Sienna just mentioned and Dr. Sharon? How can young people in Latin America and the Caribbean help shape the digital trends and innovation to help accelerate the achievement of the SDG 3 targets?
Thank you. And I will also keep it short. Thank you also for excellent moderation, Oscar. I really like the two things that really struck me is learning, that we have a responsibility to teach. Our generation, and I mean my generation of older people, and also young people. So we all, even though we are different generations, we walk that path together to integrate and maximize digital technology for our health and well-being. So I think that is a task for all of us. And then the other point, as we were talking, is maybe less popular, but Shoran and I know that being young is just a moment. It goes away, it doesn't stay. And that just encouraged me that what we are investing in young people now about the importance of digital equity and maximizing the use of digital technology, even if it goes fast, to say what is the best way we can use this not only for ourselves, but for our communities. That investment will pay off very soon because the Sianas and the Mercedeses, and before you turn around, you're the adult and I'm in the old people's home and you're the responsible ones and you have then that mindset. So really, to me, that's an illustration of what we always say, that investment in young people pays off now and it pays off in the future. So you're going to be the ones who can fulfill this agenda.
Perfect. Thank you, Dr. Sonia. And Mercedes, what do you think about this, that you someday will be the adult?
I definitely will be someday. I am not now. But what it gets me thinking is, as young people, at least now, we do have a very important role to set the bar on how it is that we must engage in, for example, policymaking that Dr. Shorin mentioned before, and to set it for the generations that are coming after us. Like, I wouldn't like to imagine a place where we advocate to have a place and a seat at the table, and then looking back as an adult and knowing it was just for a bit, and that, again, young people are not having the credibility that they must have. I don't know if I answered the question.
Answered perfect. Thank you. Thank you, Mercedes. Thank you, Sienna. Thank you, Dr. Sonia, Dr. Sharon. It was an honor and a pleasure to have you all here. Thanks a lot. So now I'll move to Spanish. Muchas gracias.
Thank you all the panelists, and now we will want to hear your comments. And so first, or now I would like to give some final words, and I would like to invite Rehman Hassan from the group of Youth for Health to give us a message. So Rehman, the floor is yours.
Deepest gratitude to all the speakers, presenters, panelists, and guests for joining us today. It is truly an honor to have been able to spend this part of the afternoon with all of you. As we've heard today, digital technology not only will, but is fundamentally changing the landscape of global development and global health, impacting all parts of the world and each of our lives. Whether it be right now, how we're communicating online, how detecting systems for natural disasters are being deployed in Chile and Argentina to prevent gender-based violence, the World Health Organization's chatbot called What Young People Want, which talked to 1.5 million young people on their health needs, or even how recordings of people's coughs are being used with AI to detect TB more effectively. It is clear that technology is a powerful tool that we must use to truly leave no one behind and use it all throughout the life course, with the ability to change the health system and support so many across the world, as Dr. Fitzgerald mentioned. As you've heard my colleagues speak, the role of youth in this effort could not be more clear. Young people are not only the future, but the present. Increasingly, technology targets and involves young people, as it should. We're 1/3 of the population. Whether it be AI-powered social media algorithms or the usage of satellites to target rescue missions for food aid used by the World Food Programme. Engaging us young people, in all their diversity across the region is critical to taking advantage of all of this promise. However, it's also important to note the consequences of these technologies and innovations. Today, we see social media content moderators forced to sift through hours of dangerous and harmful content, which hurts their mental health. We see those same social media platforms used to facilitate cyberbullying and radicalization, sometimes in a matter of hours, which Dr. Cafe has discussed in a previous session. We see increasing digital divides. Today, only 64% of those in the Caribbean have access to the internet, while 80% of people in South America have access to the internet, with clear divides on the basis of gender, race, disability, and so much more. Which is just so important, as Mirna mentioned, because our technology is only as good as the data we can provide it, which often comes online. We're also seeing technology causing immense harm, like technology-mediated sexual violence or health-related disinformation, both of which can be very dangerous. It will be up to each one of us across the world to make sure that these technologies are ultimately used for good and in the advancement of our shared goals. Technology should not be something we leave up to our governments and large technology companies to manage. We need to work together to localize these solutions based on our community needs, our country needs, and our regional needs. Each one of us plays a role in this fight, especially young people who are leading the charge to develop, implement, and use these technologies for good. So what can we do to make sure that this development is inclusive? One thing we can do is to start talking about it. We can talk about all the amazing things that technology is doing and our hope for where it can go to solve our unique needs. We can also talk about the harms that technology can cause, which is especially significant because we're using and creating these technologies. We can also talk about who is online, who are we hearing from, and maybe more importantly, who are we not hearing from? We can also teach each other about technology. How can we stay safe online? How can we check if information online is true? And how can we use new platforms to reach more people? We can also work in our communities to support organizations doing incredible work with technology. Organizations like Amazon Mining Watch, which protects the Amazon rainforest and local indigenous communities from air pollution from gold mines and unsafe living environments, which is something incredibly important, as my colleagues have mentioned, to leave no one behind and not further these already existing gaps. We can come together to co-create technology and our data sets to represent us and highlight our priorities. So my ask to you this afternoon, and I encourage you to share or respond in the chat, is what will you do as a stakeholder in this fight to make technology equitable for us? What will you do what will you talk about? What will you develop? Who will you teach? And who will you work with? Thank you so much for your time and happy International Youth Day.
Thanks, Riman. Thanks a lot. Happy International Youth Day to everyone. Feliz Día Internacional de la Juventud. Nos vemos pronto. Gracias.